Hi, everybody. Welcome. Today I have Dr. Richard Kim here with me, and I want to introduce you to him, and I want him to discuss something really important, stem cell therapy. And he's my favorite doctor of all time. If I could see him as my GP, I would do that too. I just want to just consult him for everything. So he's completely wonderful. But he specializes in rehabilitative and sports medicine, and he's board certified in internal medicine, board certified in pediatrics, certificate of added qualification in sports medicine, team physician USA Rugby. So education, MD, Albany Medical College, medical pediatrics residency, sports medicine fellowship, BS University of Washington. So I'm just putting all that out there because I want everybody to know how super qualified he is. And so, stem cell therapy, sometimes, people want to poo-poo it a little bit and say, oh, it's not, it's out there, it's not real science, but I'm telling you it's real science, and you have a real physician and a really well-educated man who's practicing this. And I'm here to talk about it because I came in to see Dr. Kim, last December, and I was in a walker. And I couldn't step outside my house. I was taking mega pain medications. I had spinal stenosis and 3 levels in my back and spondylolisthesis in the underneath it all, bones overlapping. I don't know. So I was a mess. And so I came there to see, and I had, I came with all my CT scans and MRIs and X-rays, all those things that you kind of need for him to look at, and to see if he could help me. And I brought a physician friend with me. Just so sometimes when you're in so much pain, you can't hear, right? You don't remember. So I brought her with me to remember, and because she would know really what he was talking about. And at the end of the consultation, which was wonderful. I mean, he doesn't just throw you out after 20 minutes and say, sorry, time's up, I got to move on here. He actually talks to you and talks to my friend, and I just knew it was the right thing. And that there was a regenerative medicine, and I love the idea of using your own body to heal itself, right? And so, so many of us out there, and this is not using stem cells from babies or anything odd. He takes the stem cells from your hip. So if anybody's worrying, concerned about that, nope, that's not what this is about. And I consulted many neurosurgeons. I don't want anyone to think that I just was off in la la land pursuing alternatives and with no basis. I consulted many neurosurgeons, and so it was a question of taking 3 bones out of my back and fusions and all kind of stuff. And I got to the point where I couldn't even look at the knives in my kitchen because I knew the surgery was going to be so big. And someone mentioned Dr. Kim and said, I've heard really good things, really good results, and why not at least check in? So that's what I did. And then I've had this terrific journey with Dr. Kim and his wonderful staff. And so that's what I want to say too. It's so important to have a physician you trust and a staff that's so supportive and so nice that you can feel comfortable when you're there, and you know you're supported. You can ask any questions, and so I really want to thank you for that too, and thank you for being you and hiring the people that you hire. So one thing I thought we'd talk about a little bit, I think people don't really know how much stem cell therapy has progressed over the past 8 to 10 years. And we used to be thinking it was just for athletes. It had to be a football player, and that's all it was for, and maybe for knees. But now it's used for many different things. So could you tell us a little bit about that?
Yeah, well, thank you first off for that great introduction, Karen. And obviously, you're one of my favorite patients, so this makes this interview that much easier. But just to dive straight into it, right? The evolution of stem cell medicine has really come a far ways, and as far as it's come, it still has a lot to go. You're right in that what used to be available was really for a lot of these high level athletes, and they really liked it because it minimized their downtime and allowed them to return to play as quickly and as soon as possible. But that fundamental process of minimizing downtime isn't just for athletes, it's really for everybody, right?
Mm.
For us to get back on our feet, get back to exercise, get back to worrying about heart health or combating diabetes or whatever, it all is dependent on how much we move. And so trying to minimize that, especially with regenerative medicine, is really the crux of it. Over, I would say, the last decade to 2 decades, it's really bloomed into a completely different sphere and completely different field. If you look at the clinical trials that used to be available even 10 years ago, and this can be easily done by anybody, look at clinicaltrials.gov and look at what was available 10 years ago, the number, and that will tell you the number of studies surrounding regenerative medicine 10 years ago. And if you look at what is available today, it is absolutely exponential. Some of the more sort of sexy or sophisticated things that are even being done with regenerative medicine is, in places like in Japan will form a 3D printed heart, layer it with your stem cells, grow it out, and now you can transplant
Wow.
essentially a heart that's completely your own back into your body. So this is the sort of thing where I think we're headed. Obviously, there's a lot of stigma. There's a lot of conversation around stem cells, and that takes a lot of discussion. It takes a lot of communication, and it takes a lot of different vested parties to really understand. I think the potential behind these sorts of therapies. Obviously, for people like you who've seen it, we say quite easily, well, why isn't this more prevalent? But yeah, the work is ahead of us, I think.
Yeah, for sure. And so it's come such a long way that when I looked up um, what's it called, spinal stenosis protocol at the Mayo Clinic, stem cell therapy was their first recommendation. So I mean, this is not something that's in the back alleys. This is the Mayo Clinic, right? And like you say, Japan, and it's just exponential what we can do to get that body to heal itself. And so I know a lot of people, I've seen people talking and say, well, that's not for me. I've got spinal stenosis. I've got bone spurs. Well, I'm here to tell you it is for you.
Yeah,
It is for you.
you make a really good point. The larger, academic research-based institutions, will follow the science, but they also follow the fundamentals of medicine. And the fundamental of medicine is always going to be due from the least invasive to the maximally invasive. So if there is
Hmm.
this potential for this minimally invasive therapy, you bet that these sort of institutions are going to look at it, examine it, and I think that adds a lot of street cred to
Yeah.
what we're doing, to see that large institutions like this are making it part of their protocol. Yeah.
Yeah, and even it was before they placed it ahead of, people are more familiar with cortisone or steroid therapy, but they're placing stem cells even before steroid therapy. So it's just amazing. And fusions at the very bottom, like that's the last resort.
Yeah.
So, just lots and lots of information. And so I thought maybe you could tell us a little bit more so people know you do shoulders, hips, knees. Tell us a little bit more about what you do.
Yeah. So my practice started 7 years ago as a straightforward sort of sports medicine practice, and then quickly evolved into regenerative medicine. And then now that is essentially solely what we do. Pretty quickly, we realized, as you were saying, people would be getting steroids. And then there was this giant chasm or this giant gap between what was available. And then a lot of times it led, unfortunately, directly to surgery. So the regenerative medicine really filled in this gap really well. I think it's important for a lot of people to realize that there are not only these mechanical fixes when you do something with surgery, but there's also these chemical or biochemical or biologic fixes. So that's really where our practice is focused on, is really trying to identify what is at the root, and then of course then applying the correct regenerative therapy. So we do a lot of spinal stenosis, neuroforaminal stenosis, a lot of these disc degenerations, herniations, things of that nature. But we also do a lot of knee arthritis, hip arthritis, ankles, shoulders, tendon issues, rotator cuff issues. It's a pretty broad spectrum of, of pathologies that we can apply this for, and thankfully, and so that's really where our focus is on trying to identify the correct problem, and then of course apply the correct therapy for them.
Yeah, that's beautiful. And I wonder if you could talk a little bit about the process. You know, people wonder, well, what do I do? I just walk in and he shoots me up with stem cells, and it's not quite that.
Yeah, it sounds, it sounds, like almost simplified. Oh, I just grab it from the vial.
Yeah,
And
right.
since you've been through this process, but for those listening, it's like any other doctor's office, right? So you'll come in and we'll have a consultation, and then that'll help us identify exactly, what have you tried, what have you seen, who have you seen, what sort of injections have you tried, and if we have a firm diagnosis, then great. But if not, then our first step is always trying to establish the diagnosis, because if you don't have the right diagnosis, you don't have the right therapy.
Mm,
That's one of those tenements in medicine that I think are important to recognize. And then after that, we decide: do you need X-rays? Do you need MRIs? Do you need CT scans? Do you need whatever sort of imaging? And then that, of course, helps us encapsulate your issue more completely. So by most people's account, when people walk in between the conversation and my physical exam, I probably have 75 to 85% of the information needed. And then the last, sort of 15 to 25% usually is coming then from the X-ray, the MRI, et cetera. Once that's then discovered and understood, then my treatment plan can be laid out. Oftentimes, when it does come to stem cell-based therapy, it is typically a 6-week time course. So typically 3 injections over those 6 weeks. The bookends, the first and the third injections are what we call platelet-rich plasma, and then the center injection, the second injection is stem cell-based therapy. So the first and the third usually take only about an hour, and then stem cells, especially for spine, can take a little bit longer. Sometimes up to 4 hours, sometimes even longer, and then on the shorter end, sometimes as short as 3.5 hours, but definitely within the hours time range. After that, almost everybody, I would say 99%, get pushed towards physical therapy. And this is an important secondary element. So the biology of the stem cells can help reduce the pain, or it will reduce the pain and stop those mediators from causing recurrent pain. But like anybody else who's spent any significant amount of time um, enable or disabled,
yeah.
develop weaknesses, right?
Hmm.
Weaknesses can manifest in instability, can manifest in just simple fatigue. And so that's where physical therapy really comes in. And then now that we're going to take advantage of you being out of pain, we're going to build strength and stability.
Yeah, that's amazing.
Yeah, so it is that combination for us that's been really effective, which we started since day one, and we've been.
Yeah. And the nutrition component too.
Yeah, absolutely. For us, a big component is, it's not just inject people and then send them on their way and then get
Yeah.
therapy. There are nutritional recommendations that we do that we think are critical to this. Once needles come out, the only thing that affects those stem cells is your diet. So we really feel like making sure that exactly what to eat, how to hydrate are all important components.
Yeah. So I just went into this thing saying, okay, what if I did everything they said? What if I just did it all? So I don't want to have any doubts later and say, well, I really didn't do this or I really didn't do that. I thought, what if I just did it all? So, I watched the nutritional element, and then afterward I had 4 weeks of physical therapy. And I have to tell you, my physical therapist had seen me before this, and I couldn't even get on the physical exam table. I couldn't do much of anything. And so I came walking in after, what did we say, maybe 2 or 4 weeks after we had the procedure. I can't remember. I came walking in and she was shocked. I mean, just shocked, because she thought I was going to have, this laminectomy and fusions, and I was going to be, and here I am walking in, and she's like, "What happened to you?" So I tell everybody what happened to me. But they're really, I mean, physical therapists, occupational therapists, really everybody I've come into contact with is just amazed and said, "Oh my gosh, how many people have these big procedures and are in terrible pain after?" And here you are, going in, and I'm pushing weights and doing this and walking up the steps. And it was a little bit of a challenge. I had to learn how to walk up steps again. I just couldn't remember. Like your body loses, you forget. So I forget, and going down steps. Oh, no, no, that's way too scary. Can't do that. And now I'm up and I don't even think about it. And I was telling you before we started, here I am, I walked the dog for an hour and a half, and I was out painting the picnic table. And all of a sudden I stop and I go, oh my gosh, 6 months ago, I thought I was going to be in a wheelchair. I thought I was going to be in one of those mobile cars. I really I was hopeless. And full of pain medicine. Here I am, pain free, doing all these things. And so I feel like, things that happen to us in life that are challenging, but we have wonderful information we should share. So that's what I want to do. I want to share this so people have more information about their own health.
Yeah.
And
Yeah,
yeah.
you're one of the classic great examples of being a self-advocate, and you obviously, we were there together on the team, but you've done a fantastic job coming through on the other end of this.
Yeah, yeah. So you have to do that too, and it's like, oh my gosh. And so I remember after about 1 week after the process, I called your office and I said, I feel about 40% better. Am I just highly suggestible, or is this already working? Right? And here it was working, right? So within weeks, and I remember you gave me a range, maybe 75 to 95%, which I think is really fair so people's expectations don't overwhelm them. And as I told you today, I think I'm at 110%. I'm better than I was before the whole thing started,
That's
which is amazing, which is just amazing. So, so yeah, anything else that you want to tell us about your practice, and I definitely want to give everybody the information about how to get in touch with you and where your office, and I know you've expanded, you've got more offices.
Yeah, so in doing some of this, our goal was always to, be able to expand the program and its reach for people. So we actually have now 3 offices. One office is in Skaneateles, New York, and that helps us be available to the Rochester and Syracuse folks. And then we have an office down in Suffern, New York, which makes us available to the Hudson Valley, the New York City, the Northern New Jersey folks, and being able to come see us and be part of this. Our practice just recently moved, so we're still in the Saratoga area, and just about a mile or two away. And certainly anybody who's of considering this, calling our office at 518-871-9900, or finding us online at richardkimmedicine.com. Just simple and easy ways to contact us, and they can schedule their own appointments and so forth through the webpage. So a lot of options there.
Yeah.
We are growing. We're adding a physician assistant.
Oh,
So it's definitely headed in the right direction. I think for us, you going back to what you said and what we started, my background is in internal medicine and pediatrics. It's very, very general medicine,
yeah.
specialties. But, the big thing there is that I think a lot of people that I saw was losing the ability to exercise, losing the ability to fend for themselves from a standpoint of heart disease, high blood pressure, diabetes, and being able to get back to exercise, being able to get back to activity is our primary goal. I think for us, stem cell happens to be the excellent solution to get to that point. But again, it's just what I think the practice is really focuses on is getting people moving and getting people
Yeah.
moving.
Because it becomes insidious. When you can't move, you think, I can't go to the grocery store.
Mm.
I can't do the simple, they call it activities of daily living, but it's true, or if I make myself some dinner, I can't stand up long enough to clean up. I mean, you become like your world closes in ways that you can't even imagine.
Yeah. Yeah.
So, yeah, I remember going to the grocery store trying to hobble around. The lady said, "Well, we have this thing you can, drive," and I'm like, "So
Oh,
it's come to this." Everybody can see
no.
I'm so bad. It's come to this, and to be where I am today is a miracle. I always say I feel like I'm a walking, talking miracle, and I want to share it with everybody and
I'm
share you with everybody.
absolutely. Thank you. For me, that watching you walk in, carrying your walker in
Yeah,
is my favorite moment with you. It's just okay. Well, I guess that's what we're gonna do. We're just gonna use it as a carrying weight or a paperweight.
yeah, yeah, yeah. I gave it away. I mean, I'm like passing it on. I don't even want to look at it. It's like that's gone, and it's such a blessing. So thank you so much. Anything last thing you want to say, or have we covered everything that you think is?
I think we covered it well. It's about exploring. It's about self advocacy. It's about following the protocol. It's about you know um,
Mhm.
looking at the options that are good for you and going from minimal to maximal. Yeah.
Yeah, for sure. Thank you so much.
Thanks
All
again.
right.